We are very fortunate to have Dr. Lorenzo Cohen with us today. He's the director of the Integrative Medicine Program at the University of Texas MD Anderson Cancer Center in Houston. He is a distinguished professor in clinical cancer prevention and medicine. He's a founding member and past president of the Society for Integrative Oncology and the vice chair of the Academic Consortium for Integrative Medicine and Health. At MD Anderson, he leads a team conducting NIH-funded research and delivering clinical care of integrative medicine practices to optimize outcomes for cancer patients. He's also authored the best-selling book called Anti-Cancer Living. It's been praised by experts around the world, like Dr. Andy Weil, Dr. Dean Ornish, Deepak Chopra, and John Mendelsohn from MD Anderson. He's also, not only is he a professor, a leader, a teacher, an author, but he's also a cancer survivor and has had a recent personal experience with skin cancer, melanoma. So with those words, I'd like to welcome him, and thank him for this great opportunity to chat with somebody like him.
Thank you. Thank you for having me and for doing this important project.
Dr. Cohen, one of the most common questions as oncologists and future oncologists that we get asked when we step into the patient's room after we're done describing, these are the 4 or 5 different things that we'll prescribe to you to attempt to cure your cancer or to prolong your survival is very common. Probably every 1 out of every 3 patients that we see is there anything else we can do, right? Is there something we can eat? And I find that the answers we have are not the best. It's typically goes something like, try to eat a heart healthy diet. Don't do anything special. We don't want you to lose too much weight. We want you to be able to tolerate treatment. So when you get asked that question, what is your response, Dr. Cohen?
So the good news is that there's so much that patients can do. And a lot of times I think physicians are not wanting to put pressure on patients, not wanting to make them feel, I guess you could say, guilty if they're not exercising enough or not eating the right kinds of foods. But at the same time, that disempowers individuals and in fact doesn't follow the evidence base. So the evidence base is very, very clear now that eating, and we can get into some of the details, but the overarching message is that you need to eat a primarily plant-based diet that is made up of whole foods, has low glycemic load, and high fiber. When it comes to exercise, a minimum of 150 minutes a week. The American Cancer Society guidelines now say 300 minutes a week or more is ideal. And so that's essentially an hour a day, and to sit less. And it doesn't need to be all done at once. It doesn't need to be intense at the gym. In some sense, spread out throughout the day so that you're reducing sedentary behavior, because we know sedentary behavior, independent of how much you exercise, is a risk factor for worse cancer outcomes, as well as a risk of cancer in the first place. So that's diet, that's sleep. Then patients need to know, diet and exercise. Then patients need to know about sleep. They need to know how important it is to get a appropriate amount of sleep, and ideally a restful night's sleep. And if they're not in this window of 6.5 to say 9 hours of restful sleep a night, to seek support from healthcare professionals. Overarching all of this is stress. And as I say as we write in our book, Anti-Cancer Living, stress is the saboteur of all healthy behaviors. So not only will stress make it more difficult to get a good night's sleep, have motivation to exercise, eat that healthy diet. When we're under chronic stress, we may be craving, those comfort foods, high fat foods, high carb foods. We also know that stress modifies the biology, specifically of, for example, food. So you take 2 individuals, you give them both a healthy diet. The person who's chronically stressed responds to that food in a very different way, such that their biological response to eating a healthy meal is diminished. And it's as if they've been eating, food that's not as healthy. We know also that chronic stress releases stress hormones, in particular norepinephrine and cortisol, floods the body to mount a fight or flight response, which evolutionarily speaking is good if you're being chased by a predator in the wilds. But we're not being chased by predators. We're having our life threatened by a cancer diagnosis or the stress of work or the stress of a family member, and other things in life. And that chronic stress, when that acute stress becomes chronic, it wreaks havoc on all biological systems in our body. And there's clear evidence that stress will make the tumor microenvironment more hospitable to cancer growth. We also know that stress results in the release of stress hormones, in particular norepinephrine and cortisol, and the body is flooded with these stress hormones. And for a short period of time, that could be okay. But when the stress response becomes chronic and the body's constantly being flooded with these stress hormones, it ultimately actually makes the body more hospitable to cancer growth. There's clear evidence that both norepinephrine and cortisol will get into the tumor microenvironment and make it more hospitable to cancer growth. Now, cancer starts literally originally from one mutated cell, and that one mutated cell divides and continues to grow. And if our bodily processes that exist, which are called the cancer hallmarks, that's one way of kind of grouping these biological processes. If they are not activated in a way to control that mutated cell, then the mutated cell continues to grow and we end up having a mass formed, and that's what we call cancer. Stress activates all the cancer hallmarks, all the biological processes that allow that mutated cell that started from one cell to grow and thrive in the body. So in addition to diet and exercise, which is often talked about, but not necessarily in enough detail, stress is really important because it will have a direct impact on cancer, as well as the multiple behaviors that patients need to pay attention to after a diagnosis.